Alright, listen up, because this is big. 300,000 Illinois seniors and people with disabilities are about to swap their two insurance cards for one, and if you're on both Medicare and Medicaid, the state will pick the plan for you unless you act fast. We're not talking about some minor tweak here. January 1st, 2026 is not just another new year, it is the day Illinois shuts off the old MMAI program and flips on the new FIDE SNP switch. Miss the fine print, ignore the mail, and you could lose your doctor, your pharmacy, even your home care aid. It's a huge change, and frankly, it's one you can't afford to get wrong. My name is Ben Washington. I am a licensed Illinois Medicare advisor, and I am here to help clients with this critical change. I know that changes can cause confusion, and I do not want you to panic. I know the relief that people feel when people finally understand what's happening. Stick with me for the next 8 minutes, and I promise you'll walk away knowing whether you qualify, what steps you absolutely must take, and the biggest, sneakiest trap that trips people up every single time. Consider this your cheat sheet to navigating 2026 without a hitch. So, what exactly is dual eligibility? Simply put, it means you have full Medicare and full Medicaid at the same time. Think of it like this. Medicare steps up first for your hospital and doctor bills, covering the lion's share. Then, Medicaid wraps around that, picking up your premiums, co-pays, and those vital extras like dental care, vision, or even transportation to appointments. Until now, Illinois ran a demonstration program called MMAI, that's the Medicare-Medicaid Alignment Initiative, which bundled these two powerful programs together. It was a good run, but that demo officially ends at midnight on December 31st, 2025. You can think of it like your lease ending. The landlord is switching to a brand new property manager, and you have to re-qualify or, well, move out. The state is moving towards a more streamlined, integrated approach to better coordinate your care and simplify your benefits, which is a good thing, but it means you need to pay attention to the transition. Now, let's talk about the new kid in town, the FIDE SNP. That mouthful stands for Fully Integrated Dual Eligible Special Needs Plan. Don't let the jargon scare you. Here's the gist. It's a specialized Medicare Advantage plan that, by federal law, must cover everything Medicare covers and everything Medicaid covers, all neatly tied up in one single package. Imagine the simplicity. You'll get one card instead of two, one easy-to-remember phone number for all your questions, and one dedicated care coordination team working to ensure you get the right care at the right time. This integration is designed to make your healthcare journey smoother and more efficient. The state put out a bid, and 4 insurers won the right to offer these plans in Illinois: Aetna, Humana, Meridian, and Molina. While each of them will offer the same minimum benefits, because they have to, their doctor networks and those tempting extra perks will differ. So yes, even with all this integration, choice still absolutely matters, and it's worth a closer look. Ready to find out if you're in? You'll need to pass through what I call the 7 gates of eligibility. Gate 1. You must be 21 or older. If you happen to turn 21 in February of 2026, the state will patiently wait until March to enroll you. No jumping the line, no exceptions. Gate 2. Full Illinois Medicaid under AABD. That's aid to the aged, blind, and disabled, or family care only. This is where many people stumble. If your Medicaid is through a spend-down program, breast and cervical cancer, or any partial benefit program, I'm sorry to say, you're out of luck for FIDE SNP. The state is very specific about requiring full benefits for full integration. Gate 3. You need Medicare Part A, that's your hospital insurance, and Part B, your medical insurance, to be active. If you're currently in a Part A penalty period, you absolutely must get that fixed before December, or you'll be disqualified from FIDE SNP. Don't wait on this one. Gate 4. You must be eligible for Part D drug coverage. Now, that sounds automatic for most, but some folks with past felonies or unpaid premiums can find themselves blocked. If there's any doubt, clear it up now, before it becomes a problem. Gate 5. You must live in the plan's service area. Every single county in Illinois will have at least one FIDE SNP option, but if you decide to move across state lines to Missouri to live with a daughter, for example, Illinois will unfortunately close your file. Your benefits are tied to your residence within the state. Gate 6. You must be a U.S. citizen or lawfully present. This sounds basic, right? But here's a crucial detail. Medicaid does an electronic match with Homeland Security every November. If your green card has expired, or there's any discrepancy, you'll swiftly get a denial letter. Make sure your documents are current. Gate 7. No conflicting coverage. If you've managed to keep retiree insurance from, say, the railroad or a union that pays after Medicare, you'll have to drop it. The state will automatically decline your FIDE SNP enrollment if you have other comprehensive third-party insurance that conflicts with the integrated model. Now, let's talk about a real lifesaver, the 90-day safety net. Life happens, right? Let's say your Medicaid gets unexpectedly canceled because, for instance, a caseworker mistakenly counted your stimulus check as income. You do not lose your FIDE SNP coverage the very next day. Federal rules provide you with a deeming period of at least 90 days to sort out that bureaucratic red tape. This is your window, your chance to fight. Use every single day of it. Appeal the decision, resubmit your bank statements, call everyone you can. Just don't sit still and do nothing. That 90-day period is precious. Because once that window closes, if your Medicaid isn't reinstated, you'll be booted to a standalone Medicare Advantage plan, and all those invaluable Medicaid extras, your dental, your vision, your transportation, will disappear overnight. It's a stark reminder to be proactive. Alright, let's get practical with a timeline checklist to keep you on track. October. This month, make it a priority to update your address with both Social Security and the Department of Human Services. Trust me, one tiny typo, one digit off, and your crucial enrollment packet could walk straight to the wrong zip code, delaying everything. November. Keep a sharp eye out for a gray envelope, prominently labeled, Important, Your Healthcare Choices. This isn't junk mail, folks. Open it immediately, pick your preferred plan from the options, and mail it back in the prepaid envelope provided. If you do nothing, the state will auto-assign you to the lowest cost bidder in your county. While that might sound convenient, it might not be the best fit for your doctors or your needs. December. This is crunch time. Confirm that your pharmacy and your primary care doctor are in the network of your new chosen FIDE SNP plan. If, for example, your doctor only takes Meridian and you were auto-assigned to Aetna, or you chose Aetna without checking, you need to request a network change before January 1st. Don't wait until you're sick to find out you can't see your trusted physician. January 1st, 2026. This is it. Your new coverage officially starts. February. Take a moment to review your first explanation of benefits, EOB. Make sure everything looks correct and aligns with what you expect. March. If something still feels off, don't hesitate. File a grievance. You have a generous 120 days to do so, but the sooner you act, the better. So, here's your 1-minute cheat sheet, just to hammer it home. Illinois is shutting off MMAI at the stroke of midnight on December 31st. In its place, the new FIDE SNP program combines your Medicare and Medicaid under one roof, starting January 1st, 2026. To stay in and keep your benefits flowing smoothly, you must be 21 or older, hold full AABD or Family Care Medicaid, keep your Medicare Parts A and B active, live within the plan's service area, and have no conflicting insurance. Your homework? Watch your mail closely in November, pick a plan, confirm your doctors and prescriptions are in network, and remember that critical 90-day safety net. Knowledge is indeed power, but action keeps the lights on, literally and figuratively. Open that gray envelope the very day it arrives, make your informed choice, and then get back to living your life with peace of mind. I'm Ben Washington. Thanks for letting me be your guide through the sometimes confusing Illinois Medicare maze. I'll see you in the comments, and hopefully, on the other side of a smooth, stress-free 2026 transition. Take care, Illinois.